Hi, I'm Susan Taylor at Scripps Health in San Diego, California. Skin cancer is the most common type of cancer out there. 1 in 5 Americans will develop skin cancer at some point in their lifetime. So how do you know when that weird spot on your skin might be something serious? Joining us is Dr. Hugh Greenway. He is chairman of Mohs and Dermatologic Surgery at Scripps Clinic in La Jolla, California. Thanks so much for being with us, Dr. Greenway.
Thank you.
Why is skin cancer so common?
Skin cancer is very common because of a bunch of reasons. One is which we live here in Southern California. We all love the climate. We all love being outdoors. Most of us grew up spending a lot of time outdoors. We have a lot more people that are living older now, so there's more time for you to get skin cancer than perhaps in the past. And a number of factors. We had tanning beds in the past. We all wanted a bronze tan look. So just a variety of factors contribute to the incidence of skin cancer.
There's different types of skin cancer. Why don't you explain the 3 different types?
Yeah. The 3 main types. The most common is basal cell carcinoma, which actually is the least aggressive because it doesn't spread to lymph nodes in the lungs like perhaps some others. But it's the one that we see more, probably about 2 million cases a year of basal cell carcinoma in this country, most commonly in areas where we've got cumulative sun, so head and neck, nose, ears are the most common areas for basal cell carcinoma. The second most common skin cancer is called squamous cell carcinoma, and we see about 1 million of those in this country per year. Again, more in areas where you have cumulative sun exposure. We see a lot of these on the lower lip, on the backs of the hands, and also on the face. Squamous cell carcinoma does have a risk of spreading to lymph nodes and beyond, so it's a little bit more aggressive. And then the third type is the most serious type, which is malignant melanoma, or just melanoma. Any melanoma is malignant. And we see about 100,000 cases of invasive melanoma and 100,000 cases of in situ melanoma, meaning that it's just limited to the skin in this country per year.
So how is skin cancer treated?
There are a number of ways that you can treat skin cancer. The basal cell carcinoma can be treated surgically with radiation. If there are some superficial lesions, there are actually some creams that one can apply. There was a drug called interferon that we were the first to use in certain types of basal cell.
You were the first to use actually in the world.
That's correct. Yeah, and we still use it.
That's pretty big.
I had a lady I treated yesterday with interferon, so it still is used. But so with basal cell carcinoma, there are a variety of techniques. Same with squamous cell carcinoma, although you have to be a little bit more careful with it. Both basal cell and squamous cell carcinoma in critical areas, one of the techniques we use for the invasive, the more aggressive one, is a technique called Mohs surgery, which we can talk about, which is something that we've had here at Scripps Clinic for a number of years. Melanoma is the one that's the most dangerous. It's the one that has a higher risk of spreading if you don't get it early. Fortunately, most of those we get early. There's probably 1 million people alive in this country that have had melanoma. So the cure rate's over 90%. But melanomas, it requires surgery where you take an extra margin. With certain melanomas, if it's a little bit more aggressive, we actually do a technique called a sentinel node where we check the lymph node that's perhaps closest or the one that drains to where that melanoma is.
There's bad news and there's good news with regard to skin cancer. The bad news is that so many people are getting it because the rate has gone up for older people. Is that correct?
It's gone up for older people, and unfortunately a lot of middle-aged people, we'll say, again, spent a lot of time, had a lot of sunburns in their younger years, and tanning beds were popular until just a few years ago.
But there's good news because the skin cancer rate has actually dropped for a certain group, has it not?
Yeah, the skin cancer rate for adolescents, those people aged 10 to 19, has actually been cut in half in the first 4 years of this decade, 2010 to 2014, compared to the first 4 years of the decade before. I think it's because of mothers and grandmothers and the education process we've had about protecting our skin with sunscreens, hats, and other devices, sunglasses. So I think the moms and the grandmoms have done a really good job on the younger generation.
Well, I remember, 10, 20, 30 years ago, people would, slap on baby oil and go sit in the sun and, bake in the sun, basically.
In those days, we all wanted the bronze type tan. That's what we thought was healthful. Our parents would send us out at the beginning of the summer to get the first burn because that was considered protective. It's not. But so the culture and the times have changed.
Which is a good thing.
It is an absolute good thing.
Who gets skin cancer? Is any more people who have lighter skin more prone to skin cancer, darker skin?
We see more skin cancer in lighter skinned individuals. So Caucasians, if you're red hair, light colored eyes, burn easily, you're probably one of the ones at higher risk. The darker your natural pigment, the less risk, although there is a risk that because your skin color may be darker, it may not show up as early. So sometimes a melanoma in a darker skinned person may be more aggressive just because we don't get the diagnosis as early.
If you've had skin cancer, are you at a higher risk of it coming back?
Absolutely. If you've had skin cancer, if somebody in your family's had skin cancer, I had an aunt that died of melanoma. Oh. So I'm higher at risk for melanoma. My sister had a melanoma of her eye last year.
In her eye?
In her eye. And in this country, we do see melanoma, while we talk about it being on the skin, most commonly on the chest, the back, the lower legs, we do see it in unusual places, and the eye is one of those. She actually lives in Alabama, went to Auburn University, so she's actually part of the cohort that they're looking at now because there appear to be a cluster of cases. Hers was a little advanced, and she actually had to have her eye taken out.
Oh, my goodness.
Fortunately, one of the things we check now in skin cancers and melanomas that are a little more advanced is a genetic profile. We take part of that tumor and we compare it with a group of genes, and through a genetic test, we can tell you're class 1 or class 2 and give you some indication of how well you're going to do over the next 5 years. Fortunately, she's a 1B, so she has a cure rate of 80% over the next 5 years.
So what are the survival rates for the different types of cancer?
Fortunately, for melanoma today, the 5-year survival rate is 90+%.
And before, it used to be just months, correct?
It used to be months because we didn't make the diagnosis early, and we didn't have the treatment regimens that we have. For advanced melanoma that spread to lymph nodes or lungs or brain, Jimmy Carter, perfect example, had metastatic melanoma. Years ago, we would talk about survival in terms of months. Now we talk about survival in terms of years because of all the new immunotherapy drugs that we have.
And so immunotherapy means what?
Immunotherapy, as opposed to chemotherapy, chemotherapy is a drug that attacks good cells and bad cells, and so there are a number of side effects. Immunotherapies target specific pathways against that melanoma. So it's more like shooting a bullet as opposed to a shotgun.
What about the risk of getting cancer in terms of sunburn? Let's say you had a sunburn as a child. Does that increase your risk of getting skin cancer if you just had one sunburn? Or does it take 10 sunburns or 20 sunburns?
Only takes one.
Wow.
It increases your risk of melanoma, and it's usually 20 or 30 years later. There's a lag period that we look at. So if you've had one sunburn, and most ladies had one, that included their back and lower legs, then you are higher at risk. And if you've had multiple sunburns, you're at risk. If you've been to tanning salons, you're at risk. So there are a number of factors, and sunburn certainly is one of them.
Talk a little bit more about Mohs surgery, because I know that it's something that you're one of the top Mohs surgeons in the country. Explain what Mohs surgery is.
Yeah. Mohs surgery is a type of surgery where we remove the skin cancer, and it gives us a higher cure rate because we're able to look at the margins, every cell in the outer margin, and take less amount of tissue. So we would take that cancer and then we would use a curette or a device to remove what we see in terms of like it being a pie on the skin. And then we'll take a special scalpel and take a layer around that, sort of like a pie crust around that pie. Then we'll take that layer and we divide it into smaller pieces where it'll fit on a cryostat in our laboratory.
What's a cryostat?
Cryostat's a machine that we use to make thin slices, 4 to 5 microns, of the tissue. And then that thin slice of tissue goes on a glass slide, and we look at that under the microscope. And when I do that, I'm looking at two things. One is to make sure the margins are all clear, and we put dyes on the edges so that we know that it's there, and to see if there's tumor there or not. Hopefully not. But after we take that first layer, hopefully you're clear, and then we can go to sewing it together, reconstruction ourselves or with our colleagues. If the tumor remains, say, in one area, we would go back and take a little more, but just in that one area. I don't have to go all the way around. So it's a precise method of tracking out the skin cancer.
So let's say I have one on my cheek, right? So let's say it's here, and you're talking about the pie. You say when you take the first slice off, when you go underneath the layer of skin, it actually could be much bigger underneath the skin, correct?
Yeah, one of the things that we talk about is when you have a skin cancer, say a basal cell carcinoma, there are a number of different subtypes. Just like you have 5 fingers on your hand, there are different types of basal cell carcinoma. And fortunately, most of them are nodular and grow out, but there are some subtypes that are infiltrating that'll have roots, and they can be more aggressive. And so Mohs surgery is certainly indicated for those types of tumors.
So I have a little tumor on the cheek. You use one thin slice, and then you take that piece of skin, you put it underneath the microscope, see if the cancer's there.
Yes.
And then when you talk about the margins, you're saying you actually take an area that's slightly wider than the tumor because you want to make sure that there aren't any weird little cancerous cells that are poking out.
Right. We want to achieve the best cure rate and take the smallest amount of tissue that we can.
Are you put out for this procedure? Are you under anesthesia?
Most of the time it's under local anesthesia. If you'd like to have something to relax you, we can do that, provided you have a driver that day. But most of the time it's done under local anesthesia.
So you're awake for this whole thing.
Yeah.
But you numb it out, so obviously it's not painful.
Actually,
there's no
yes.
pain in this.
There's no pain, and one of the important things is for you as the patient to have a good experience. So we want to be sure that the numbing medicine is done very gently and that also it lasts throughout the procedure.
And how long does a Mohs procedure usually take?
We usually say that we'd like you to be with us about half a day because of the repeat areas if we have to. And then once we're done, we'll need to sew it up so you look nice. And we will do that in our office, or sometimes we'll have the plastic surgeons or the eye surgeons or the hand surgeons. So we really use a team approach here at Scripps Clinic and Scripps.
Cool. So melanoma, skin cancer in general, it's mostly on the face, mostly on the legs?
Well, it's mostly in areas where you've gotten more cumulative sun exposure. Although we train doctors, and one of my doctors that I trained this year actually did his presentation at Grand Rounds on skin cancers in areas that don't get a lot of sunshine. In the groin area, the genital areas, and we do see those there, but most commonly in areas where you get more sun.
And if you have melanoma and it comes back, if it metastasizes, where does it show up when it comes back?
Yeah. Normally, the first place that a skin cancer, including a melanoma, will go is to a lymph node. The lymph nodes are sort of a filter drainage system of the body, and the body's very organized. So most commonly, it'll go to a lymph node, which is why with certain melanomas and squamous cell, the use of a sentinel node biopsy test to tell us if it's spread at that time is very important.
If you've had a sunburn as a child or a teenager or in college, when should you start paying attention to your skin, and what does that mean? Does that mean you go see a dermatologist every year? What does that translate into?
Okay. The skin is the largest organ of the body. It needs to be evaluated periodically. You go to the dentist periodically, you go to the eye doctor, so you need to have your skin checked. I used to be a family physician, and family physicians are very good at checking the skin. So when you have or an internist, when you have your annual physical during the year, you should be sure that that person does that. If you're higher at risk with some of those things you've mentioned, it's probably a good idea to have a dermatologist see you. Understanding there's only 15 or 20,000 dermatologists in the country and over a couple 100,000 family physicians and more internists. But if you're higher at risk, then you perhaps need somebody that looks a little closer.
At age what?
Well, I
think to look.
We actually have a pediatric dermatologist. So if you're here, I think it's probably a good idea by age 10 to start being checked. If we live in San Diego, by definition, we're outside more. We're going to get more sun. So most people here probably ought to be checked once a year. If you've had a melanoma, we're going to ask you to come see us every 3 months for 3 years, and then probably every 6 months. So if you're higher at risk. Now, we also try and teach you to check at home too.
We're going to talk about that in just a couple of minutes. So hold that thought. We're going to talk about a skin cancer self-examination. How often should you do it? What you should be looking for. And we're going to talk about the A, B, C, D, and E's of melanoma. What are they? And you will want to write this down. So we'll give you a couple of minutes to grab yourself something to write it down with. When should you go see a doctor, Dr. Greenway, if something on your skin looks a little odd?
Sometime the next day or within the next week or so. And the reason I say that, prevention and early diagnosis are the key with any type of cancer, including skin cancer. I'd much rather you come in and I say, don't worry about it, it's a genetic thing or whatever, than opposed to saying, I wish I'd have come last year because that spot has been there for a while. But
what are the symptoms? Is it like crusty, or if it's just weird red, or if your skin is extra dry? What are some of the things you're looking out for?
For non-melanoma skin cancer, the basal cell carcinoma, the squamous cell carcinoma. For a basal cell carcinoma, it's most likely a little bump that's red, pearly, maybe have a few little broken blood vessels on it. If you ignore it, it's going to outgrow its blood supply and it'll bleed, then it'll heal over and you'll think, oh, that's good, and then it'll come back again. With a squamous cell carcinoma, it's more a little crusty area that you may actually feel more than you see, type sort of thing. So those are the two common things that we tend to see.
Let's backtrack for a second. What is a precancerous growth?
A precancerous growth, in most cases, is a growth that's caused by the sun. We call it actinic keratoses or solar keratoses. So the sun has damaged the skin, and it starts this process of where you get a growth and a crust. The reason we treat these precancerous processes is a certain percentage, somewhere around 5%, will then turn into a squamous cell carcinoma. So it is a good idea to be checked, and if you have any precancer lesions, for them to be treated.
There are some really good aspects to being in the sun.
Absolutely.
I mean, it obviously provides, vitamin D. So what's your recommendation for how much time should you spend outside each day? What time of day you should be outside?
Yeah. Well, we all love the sun exposure. I have patients come in that have had a skin cancer or melanoma and say, would it help if I moved to Alaska? I don't want to, but would it help? One of the things to realize is that most of us have gotten our sunburns and most of our cumulative sun exposure by the time we're in our mid-adult life. By the time you're 45, 50, 55. In other words, we were outdoors more when we were younger. So it's a situation of being aware, but you don't have to become a hermit or anything like that. You're going to get some sun exposure, enough for your vitamin D, just walking to the car back and forth every day. So a little sun is fine, but we really don't want you to go to a tanning salon to get a tan so you'll look good when you go to the beach, which is what people used to do. So it's okay in moderation, just like we talk about other things in life in terms of moderation. But definitely, we do not want you to get a sunburn.
So if I'm out in the sun, should you avoid being out in the sun from 10 a.m. to 2 p.m., which is when the sun is strongest?
Yeah, we say that that's when the sun is the closest to us. So yes, that period of time, we'd prefer, if you're going to have a game of tennis or whatever, that you do it away from that mid-noonday sun.
And what if I'm going to go down to the beach?
If you're going to
be in the water, be in the ocean, or be in a pool.
So, first of all, you're going to go do it anyway. Okay? So it's not like we can tell people don't ever go to the ocean. So you're going to do it. So basically, again, the time of day, and also there are a number of things that we'll ask you to do that are common sense things to protect your skin.
Let's talk about those common sense things.
Yeah. And the first one is just how much time you're going to be out in the sun, and depending on your skin and that type of thing. The other thing we talk about are sunscreens. We didn't have sunscreens when I was growing up. We had the baby oil iodine type thing. Sunscreens first came out, I don't know if you remember, there was a number 2 on them and a number 4, and they were really for just UVB protection. Now we have sunscreens, and we have a number of different types. And one of the important things is to look at the number on the front. This one's a 50, but we'd really like for you to have at least a number 30, and to also remember that you want a broad spectrum sunscreen. And what that broad spectrum means, it protects against both UVB radiation and UVA radiation.
What's the difference between UVB and UVA?
Yeah, UVB is a shorter wavelength that causes burning. UVA is a longer wavelength that contributes more to things like melanoma and stuff. So we really like that. So sunscreens come a number of different ways. They actually make them in a stick now that you can put on, type sort of thing. Men especially, when we use a sunscreen that was a cream, you put it on and then the man would go, what do I do with what's left on my hands now? Ladies would know. And they come in sprays. Sprays used to not be very good, okay, but the sprays now are just as good as the other vehicles that they're carried in. And we also have sunscreens that are made for kids. What I tell parents to do is if you got different kids, let the kid choose the sunscreen because then they'll buy into it, type sort of thing. And we have them for babies. Some people are sensitive to sunscreens. Sunscreens come different ways. There's actually a chemical in some of them, and there's a blocker in some. And a lot of them will have both now. If you're sensitive, you need to avoid PABA, which is the most common ingredient in sunscreens, and use one that has more of the little powders, like used to be zinc oxide, the old white paste we'd put on our nose. Now we have something called titanium dioxide that you can use. That's the little powders that don't show up, and they're much more cosmetically agreeable. The other thing to remember is they're not waterproof. They're water resistant.
So if you're in the pool swimming, for what period of time, or if you're out in the ocean swimming or surfing, how often should you be reapplying your sunscreen?
Probably about every 2 hours, if you can do that. Because again, they're water resistant, not waterproof. And that's what pretty much, they'll all say that on the bottle now. There'll be an expiration date too. So, you can't keep them in the shelf for 3 years and then use them. If there's no expiration date, it's good for 3 years from the time you bought it. But most of them will have an expiration date on it now.
So I see the SPFs, the sun protection factors, you should have ones here that are 50. You say the minimum amount you should put on would be what?
A 30.
A 30. They have SPF factors now which go up to 100.
Yes.
Is there a difference between 30 and 50 and 50 and 75 and 100? Or really if you have 30 on, you're okay?
There's a small difference. A 30 will block out 90% of the bad rays. So beyond that, you're really working in a small percentage. We grew up here in America, and we kind of have this culture, if a little bit is good, then a whole lot must be better. That's just the way we are. We were raised that way. So if you've got a 30 and a 50, you think, well, maybe the 70 is better. And it may be if I'm going to be in and out of the water, there's a lot of wind blowing or stuff, but we really want you to get into the use of it as a habit. Actually, ladies are much better because you have sunscreens in your makeup now. Most men don't wear makeup, but one thing we do is we shave every day, most of us. So what I try and teach my men patients is to find one to use as an aftershave lotion.
Interesting.
And put it on, and then when you put it on, take what's left and wipe it on your nose and your ears. Maybe not on your forehead, because if it comes down, it might bother your eyes, so you wear a hat with that. But again, if you can get in the use of doing it as a habit, and the face gets the most sun, habits actually are good. If you can replace, and that's how you do new things, you replace an old habit with a new habit.
And what about the low-tech stuff, like the sunglasses and the hats?
Yeah, well, sunglasses are very important. Or you can have the transition ones. These, when I go outside, will change. But they need to be good sunglasses, not cheap sunglasses. But sunglasses are very good for two reasons. One, protecting the skin around the eye, where we see a lot of skin cancer, especially the lower eyelid. The sun comes from above, so we see more on the lower eyelid. But then also protecting the eye itself. We talked about eye melanoma. Hats are very important. However, we'd like you to wear a wide brim hat that protects the ears, as opposed to a baseball cap type sort of thing.
Okay.
And then there's also clothing for people. There actually are sun-resistant clothing that will have sunscreen in it.
Oh, interesting.
That will last for several years. So it is easier now to wear long sleeves. When I go out and play golf, and I love to play golf, people say, you must be a dermatologist because I have a hat and long sleeves on and that type of, in lighter colors. But so there are a number of things that you can do, and again, it just makes common sense.
And you've got something pretty high-tech which is on the horizon, having to do with your cell phone?
We do. There are a number of things that are coming. We all love gadgets and high-techs. Actually, one of the big companies that make sunscreens and moisturizers and makeup products has a device coming out this summer that actually hooks up to your cell phone and allows you to measure points on your face to tell you about the health of your skin. It actually looks at the amount of moisture you have, the pores, the wrinkles. So I think that's something that's going to be really exciting. I think you're going to see more of these, but this one will come out this summer.
So what will that app do on the phone?
That app will give you a score of how healthy your skin is, looking at the moisture, the pores, and the wrinkles.
So we're just going to have people like this all the time now holding their phones up to their skin. Okay, so preventing skin cancer, the key is catching it early, right?
The key is catching it early.
So let's come back. Let's come back to what we were talking about a little bit earlier. A skin cancer self-examination. How often should you do it? And then what are those A, B, C, D, and E's of melanoma?
If you're at high risk, we'd actually, or if you've had a skin cancer, we'd actually will teach you how to use a mirror or a couple of mirrors and ask you to do it once a month. May is Skin Cancer Month. We have melanoma awareness during the year. But I think you need to go in and be checked, living here in California, at least once a year. The most dangerous skin cancer is melanoma. Melanoma comes from a mole in most cases. Half of it is a mole that you've had on your skin that changes. One of the things I try and talk to my patients about is the average person has 20 to 40 moles on their body. They're there, you're really not aware of them. If you have a mole that starts to itch, or a mole that you're just aware of, that may mean that that mole is starting to change and should be checked. When we talk about moles, we talk about your A, B, C, D, and we use these to look at changes on a mole. If you look at most of your moles or brown spots, we use the A for asymmetry. Most of them are symmetrical. So if you've got one that's not symmetrical, that could be an issue. B is for borders. Most of the borders around a mole are regular, but if you've got a border that's got several notches in it, so it's an irregular border, then that's another sign. C is for color. Most moles are pretty much one color or brown, and if you start to see a variety of colors in a mole, some reds, some blacks, the classic melanoma is a black mole, so color's important. D, we used to talk about diameter, but that we don't talk about anymore. We actually say D is different. We used to say D is diameter was 6 millimeters because most melanomas were greater than that. But now, because people are so aware, with education, with the mothers, the grandmothers, the family physicians, the internists, the dermatologists, D is different. So if that mole looks different from the others, it may be a sign. And E is evolving. So if the mole's changing and things. So we use those 5, A, B, C, D, E. One of them by itself may not mean a whole lot, but if you put the 5 together, they can provide some information.
As you tend to get older, you tend to get dark spots on your skin.
Yes.
Is that something that should be of concern to you?
There's a characteristic called seborrheic keratosis, which is a rough type of spot that comes from genetics. So as we get older, we're going to see things that some of which are at risk and some are not at risk. I would say that, in most cases, those benign changes are not significant. But again, if you have a family history, if you live here, you ought to be checked at least once a year.
And you've mentioned tanning beds several times. Why are you so against tanning beds? Why do you think they're dangerous?
Because of what they do to your skin.
And
Two
what do
things.
they do?
One is they significantly increase your risk of melanoma. And the second is they make you look old. Okay? And people don't like either one of those. When we talk about protection of skin cancer, and we've made some great gains, we actually look at it like the tobacco industry. 60 years ago, instead of these sunscreens here, there would be an ashtray here, and you and I might be smoking or whatever. It was accepted in those days. We didn't know all the dangers, which we do now. And you go to a restaurant, if somebody were to light up a cigarette next to you, you'd be offended. And they can't do it legally anyway now. So in the skin cancer and dermatology area, we've actually used what's been done in the tobacco industry, which is education and regulation. The FDA first started looking at tanning beds in 2010. California was one of the first states that said for teenagers and minors, you can't go do that anymore unless your parents say so. Tanning beds are now regulated in 44 states. There have been 9,000 of them that have gone out of business, and that's bad for that person that owned that business, but it was bad for people that had tobacco shops too. So through education and some regulation, you'd rather do it with education, I think we have made gains. But if you say you're going to be in a wedding next week and you haven't had a chance, my wife's from Montana, and she's from western Montana, and the sky's gray for weeks at a time in the wintertime, and people get depressed and stuff. And that's one reason tanning beds are more popular there. But if you say, I'm going to be in a wedding, can I go once just to get a little color because I'm going to be in pictures, then okay. But don't buy a membership in a tanning salon type sort of thing. It's the worst thing you can do to your skin.
And just before we wrap it up, one final thing. When you do the self-exams and you're looking for all these different things, should you do a self-exam, once a month? Kind of like, they say to women, do, a breast exam, a self-exam to make sure that you look for any lumps or something? Because obviously the key with cancer is detecting early.
The key is early diagnosis.
Yeah.
If you can look at it once a month, that's fine, and that's good. Especially, I would say yes, here in Southern California, where we have the sun, we have the climate, we're more at risk. Most of us know somebody that's had melanoma. We had a family member that's had, so yes.
But if you're the mother of a teenager, should you be saying to your teenager, let's just take a look at your skin, once a month and make sure everything's good? Or do you wait until you're 25 or 30 or 40?
Yeah.
Or is there no hard and fast rule?
I think it depends on your situation and your type of skin, your color, your eyes. You're more at risk. It's going to be hard to tell your teenager we want to look at you once a month. The normal thing is like the call I got the other day. The mother happened to look on the son's leg out by the pool and goes, "Where'd that come from?" And of course, it was a melanoma, which was unfortunate. But of course, the kid was in my office the next day, and we took the teenager and took it out, and it did fine.
Any final thoughts for our viewers?
I think that moderation is the key. We all enjoy the sun. We're going to be in the sun, but get in the habit of sunscreens, hats, glasses. Have a good time while you're out in the sun, but be checked periodically.
Dr. Greenway, thanks so very much. We appreciate your time.
Thank you.
If you'd like more information on skin cancer and how to treat it, please click on the link or go to scripps.org/videos. If you want more critical information about your health, we take care of you from head to toe. Please subscribe to our Scripps Health YouTube channel and also follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.